Thanks everyone for joining our last session of the summit. My name's Jeff Todd, and again, for those who would be visually helpful, I'm a Caucasian man. I'm wearing glasses. I have a dark beard, wearing a blue shirt, standing in front of a background with it's largely brick with a clock over one shoulder. I'm really excited about this last session. We're going to explore a very large population in the US, but one that's often overlooked when we talk about healthcare. So I'd like to introduce the closing speaker for the 2022 Focus on Eye Health Summit, Dr. Amelie Ramirez. Dr. Ramirez is the director of Salud America National Program, the director of the Institute for Health Promotion Research, and the chair of the Department of Population Health Sciences at UT Health San Antonio. Today, she'll be speaking on the new vision for reaching Latinos for systemic and behavioral change. Please welcome Dr. Ramirez.
Thank you for this opportunity. My name is Dr. Amelie Ramirez, and my kind of self-description is I have brown shoulder-length hair and I'm in a bright pink today. I too try to put on bright colors whenever I can. And so my presentation today is really going to focus on the US Latino population. You know, this is now the majority minority population in the United States, and we oftentimes don't address some of the health issues facing our community. And so my job today is to really kind of share that with you, and maybe these are strategies that are not necessarily specific to eye health, but perhaps you can take some of them and utilize them for that purpose. So I hope that you'll enjoy this learning opportunity. Well, first of all, you know, Latinos now are the majority minority population in the United States. In 2020, we numbered over 60 million individuals, and projections are that by 2060, we'll number over 111 million individuals in the United States. And we go by a number of names. Sometimes it's Hispanic, sometimes it's Latinos, Latinx, or very specific by the area of origin that we come from. And so I wanted to share that though the preferred term is really Latino, and Latino is inclusive of men and women, Latinx is a new term that has not been quite picked up by a number of individuals, but is kind of considered a gender neutral term. And so you'll hear that mainly in the growing mass and social media. And Latinos are very diverse. We're very heterogeneous, although the large proportion of Hispanics or Latinos in the United States are of Mexican-American descent, many born and raised here, and then also including our recent immigrants. But then we're followed by a Puerto Rican population of almost 9.7%. And then you can see on the left here, all the different other representations of Latin Americans here in the United States, followed by Cubans, Salvadorians, Dominicans, Guatemalans, and Cubans. But some of the things, there's many differences, not only in education and SES level, but one of the things that our community is facing is the vast inequities that have really shown through, especially as we were all hit by COVID. But our community is really hit by poverty and income inequities. Almost 1 in 3 Latino families live in poverty. They have less stable housing, and now with housing costs increasing, that's becoming even more difficult. Many of our communities lack, appropriate places to buy foods, healthy and fresh foods. And so we call these either food deserts or food swamps. And then many of our community members are exposed to pollution and other toxins, but not only because of what they might work in, if they're using quite a few pesticides, but or live near kind of poor air quality areas. And then also just in terms of transportation, they have less access to good transportations in their neighborhood. And then even the recreational facilities, you will find that in our Latino dense communities, you'll have less parks and places to play, safe places to play for our children. Then when we look at another set of areas, We also see that in terms of early education, about 42% of our kids live in what we call childcare deserts, and 40% of them only participate in preschool programs. And so we really need that early childhood education for our communities. And then when we look at insurance rates, some of our Latino communities have no healthcare coverage at about 15%. And then some of our children are exposed to adverse childhood experiences that really impact their quality of life going forward. And also, again, mainly exacerbated through COVID, was the misinformation that was disseminated through social media to many of our community members. And what we're seeing is that there's truly a lack of very specifically tailored and culturally tailored educational outreach programs for our communities. So all of these things are really important. And we know that many of our community members, are suffering from eye diseases, but they're not getting the regular, yearly examinations that we should see. On this next slide here, you'll see some of the major things that we're seeing in terms of health issues in our community. One of them is obesity. Right now, we have higher rates of obesity in our children, 21% compared to 12% for non-Hispanic whites. And so this is growing. We all know that childhood obesity has become a major issue. And with that, we're also seeing an increase in diabetes being diagnosed younger and younger. And we all know that that contributes to vision loss in many of our members as well. So as you can see here, we're just seeing high rates of vision loss and blindness that are caused by diabetes and a number of other health problems as well. Cancer has now become the leading cause of death in our community. And within those cancers, we have specific types of cancers, which I have spent most of my time addressing, to help get our community to come in for early screening and detection. And then, unfortunately, we're also seeing higher rates of Alzheimer's. So what's going on here? This picture is really concerning to us, where we're seeing 1.5 times of our Latino community members more likely to develop Alzheimer's diseases than non-Hispanic whites. And then when it came to COVID, 24 or almost 25% of our Latino communities were impacted by COVID, and really impacted by many of the costs that were associated with that. And so we know that, social determinants of health have many different ways of impacting our community. And so our job at the Institute for Health Promotion Research is really to find out new and innovative ways of how could we change this in our communities and empower our communities to want that change. And so right now, the next few slides are really to share with you some examples of how we're using social media as ways of reaching out to our Latino community. And the reason for that is that they're some of the highest users of social media. So one of our programs is called Salud America. And Salud America is a digital platform with a digital network of over 500,000 advocates that we fuel each and every day with Latino-focused content, data, tools, and encourage actions that our community can take to make systemic changes in their community for health equity. Our digital channels include our high traffic website, our large social media following, our emails that are framed around specific equity data and solutions, and digital events such as webinars and tweet chats and podcasts. So all of these things really are important for us to help disseminate our information. And the way we do that is that we have health communications folks on our team that help us collect some of the latest and most important information on health. Then we craft that into a very compelling story And we go out and we look for individuals that we call our Salud heroes. These are individuals who have specifically taken an action to help improve their health or become an advocate in their community that created a specific change for the better in their community. And by using real people, we're able to utilize the language that's used by that community. We're able to bring in the cultural components that are extremely critical for us to make that message credible, because it's the person who's delivering the message is real and authentic. And then we disseminate that information through our different social media contacts, such as our tweet chats, our emails, our specific kind of action campaigns or conferences, or our scientific publications. This is just an example of some of our digital content. It's an infographic that we were doing a campaign to really get kids to drink more water and reduce their consumption of sugary drinks. And these are infographics that can be downloaded from our website for free. You can use them and take them to your school or your PTA or your child care center to really share with other parents or individuals who are interested perhaps on topics such as this. But this is just one of a number of topics that we developed. And on our network, you say, well, who's in your network? Well, we have over 500,000 individuals that are truly following us. And what you see on this map where you see the largest bubbles, that's where we've been able to document the highest concentration of individuals and kind of where they're coming from. But they can be community leaders, parents, healthcare workers, researchers, school personnel. It's anyone who's really interested in learning more about Latinos and wanting to reach them with, some positive health information. And because my team and I, our background is in health communications and really working with theory, that our work is based on the social cognitive theory developed by Albert Bandura many years ago, where he said, if you can get real people to share how they went about changing, you can increase other people's self-efficacy because they identify with that individuals. And I said, well, if they did it, perhaps I can do it as well. And then by sharing our information through our social network, we can reach a lot more people to gain what we call collective efficacy. And so together, by increasing self-efficacy and collective efficacy, we can encourage greater change. Let me give you a specific example here. One of the programs that we have gotten a tremendous amount of coverage on is what we call our Handle with Care program. Here, our Salud Hero stories are peer role models that we have written about and provided some video narrative to strengthen the knowledge and to promote that engagement. So people get to hear how these individuals actually implemented the program. What were some of their barriers? How did they share that information with others? So that, again, we can grow that empathy and familiarity with the content of what we'd like them to disseminate. So again, it's these individuals sharing who had their goals and how they achieved these experiences. And so by seeing these videos of these Salud heroes, individuals get that verbal persuasion. They can visualize how that project was done and how they were able to make that change. And then, in addition to providing the stories and the importance of showing our role models, we've developed what we call our toolkits or action packs that give you really how-to information to take this innovative program and bring it to your community. So again, working with our role models of Diana and Livia, we were able to, based on what they shared with us, we broke down their information into this 5-step action pack, and how they could start this conversation of how to develop a program that was entitled Handle with Care. In that, we provided model emails, how you can have specific talking points to engage others to think about the program. Then we helped them create a vision, and we provided guides on materials on how to plan that, who to invite to your sessions, how to conduct that community meeting so that you could build the support that you needed to start that program. And then how to create your notification flow. Here, it was an important step to have the schools work with the police department. So we talk about who you needed to contact in the different systems so that you could create that handle with care notification flow. And then the fourth step was how to implement the program. So again, samples of materials to train the police, the school, the mental health care work personnel in the school so that they would all be on the same page, and then how to promote the program. And the unique thing about this program is that we wanted to create a better place for our children when they came to schools. Oftentimes, these children may have experienced a traumatic event in their household the day before or a couple of days before, but nobody knew about it. So whenever that child may have acted out at school, no one had an understanding of why this might be happening. But by creating this network of the police department informing the schools just to be on the lookout and to provide any additional support services that our children might need, it really helped reduce the stress for that child and let them know that they were cared about. And so, these action packs have really been very unique. And again, as I mentioned, they provided model emails, talking points, templates on how to create that notification flow, and then also just frequently asked questions about training. And then our curators were also available to provide technical assistance so that they could assist the individuals that might be having some difficulty in trying to create that program at their level. And so it's this really trying to close the loop on some of these action packs. And here we had over 1,200 police and school leaders who have actually taken the time to download the action pack and to start that planning in their communities. When we first started this back in 2018, there were only 28 states that were actually using the Handle with Care program. And now that has grown to over 45 states and continues to grow. And we're looking for other mechanisms to continue to expand the program. And then another very vital tool that we have developed is what we call the Salud America Health Equity Report Card. Here, it's an opportunity to see what are the things that are most impacting your community. You can go to our website, you can put in the name of your county, the area that you live in, and then say, here to the left, what are some of these points that you might be interested in? Do you want to know what your poverty levels are? Do you want to know if your communities have good food access? And how do you compare to, other places in your state? So here you have county level data, you have statewide data, and then it gives you a comparison to the US. And what we've heard from individuals who have downloaded this kind of report card is that they've used it sometimes to take it to their city councils to demand for certain changes in their communities. Others have used it to help write community grants to help try to get resources to solve a particular issue in their community. And then we've also gotten very innovative with using tweet chats. And tweet chats is just an amazing amount of opportunities here, because this one was one that we actually worked on and trying to get specific information out on eye health. And, we talked about different types of things, but I'm sorry, this one was on vaccines. But here's the different partners that we worked with and talked about the importance of using and working with these various groups of individuals. And in 1 hour, we can generate over 6 million impressions. And something that we haven't had the time to do yet is really go into some of the content of some of these tweet chats to get a better feel of how people understand and how they're communicating their specific information to their local sites. But this is where all come together on a Tuesday, once a month, to talk about different health issues that are impacting the Latino community. And another really important area for us is clinical trials. And there's clinical trials that we use to try to come up with better medications, but whether it's for eye health, for cancer, or Alzheimer's. But it's so important that our community knows about what are clinical trials. And if they were to be offered one, why should they consider participating? And we have to overcome so many specific barriers to encourage people to even think about clinical trials, because people say, I don't want to be in a guinea pig, but they lack the understanding that you get either the state-of-the-art treatment or something that's new that's being tried to see if we can even get a better treatment available. So we're fortunate to be part of the Genentech and the Genentech Foundation's role to really promote health equity and diversity in STEM. And so Salud America received a grant to really talk about the inclusive clinical trial participation and recruitment. And so we are really promoting cancer trials and Alzheimer's trials to encourage better engagement from our Latino community. So our step one is to really promote what kind of trials we have available. This is more centralized to San Antonio, but we're also trying to find other national trials that can be open that we can refer individuals to, so that it's not San Antonio focused, but more on a national basis. We also try to uplift our stories on our Latino role models who've actually participated in a trial. And this is Alma Lopez, where she talks about she had breast cancer and she was given the opportunity. She's more than 15 years out from originally being diagnosed, and she credits a lot to having participated in a clinical trial. And so we also are talking about the importance to donate biospecimens, because again, why these are important is that if we don't have good diversity in both our biospecimen collection or in clinical trials, the latest drugs or therapies that might be developed might not be universal and good for everyone. Or we need to find out, are we more susceptible to a side effect because maybe there's something in our composition? And so it's really important that we see a tremendous diversity in clinical trials. Now I'd like to switch a little bit from just social media, but how we utilize that instrument that we carry in our purses and our pockets every day and are beginning to dominate our lives, and that's our cell phones. And so what we're trying to use is how can we work with our physicians and medicine to help people become more adherent to their medications that they have been prescribed. So here we're working with breast cancer survivors where we are sharing, there's oftentimes are put on a hormonal therapy because we know that can improve their long-term outcome. But even though we know the potential for the long-term outcome, less than a third of breast cancer patients take their medication on a regular basis. So, many of them don't adhere to this, and there's many barriers in terms of why people don't, participate in their full treatment as they should. But our goals for this program was really to develop and test a bilingual interactive mobile app that we could use in conjunction with our breast cancer patients and interact with them in a wonderful way. We designed it so that it is a controlled study, so we can tell if we were making a big difference. But the intervention aim is to truly empower the patient's own self-monitoring and management, as well as to facilitate patient education and give feedback to the doctor if the patient's experiencing any kind of side effects or if they're having any concerns about, how the medication is working with them. So again, the phone, the patient, the phone, a patient navigator, and the clinician are involved in this particular program to make sure that we are providing the best and appropriate care. And these are some of the things that we are looking for to see if our phone app has made a difference. Did we improve medication adherence? if the patient's experiencing some kind of depression, we had special messaging there to see if maybe we could help them deal with that, or that if there was some severe depression, that they would get referred to the physician as quickly as possible. And then most of all, how they were doing on a regular basis themselves. And we went through a number of steps to actually test this approach. We did focus groups, we did in-depth interviews with healthcare providers, we designed a mock-up, and then we took it back out for what we call beta testing to see if they liked what they saw. And then we had internal testing, and there was just this continuous feedback loop to make sure we developed the best that we could. And here we have, just our materials to help us promote the program throughout our clinics, and to get people to enroll and ask us questions about how they could have, access to this program as well. And this was supported through the Susan G. Komen Foundation and our Mays Cancer Center as well. And then our results is hopefully long-term that we'll see some reduced healthcare costs and improvement in breast cancer outcomes by reducing recurrence, by improving quality of life, and just mainly overall life expectancy to improve. And so that, once we finish with this study, we hope that we can expand it to other treatment agents as well. And another project that we developed is it focused on smoking. Smoking is still one of the most top preventable causes of death, but we're seeing a rise in our young Latinos in terms of taking up smoking. It costs us billions of dollars every year. And, we wanted to see what we could do, because current counseling classes and things like that have not been as effective, particularly again in reaching out to our Latino community. But most of our young adults, over 98% of them, have a smartphone. And so what we did here is actually came up with a coach in your pocket. We developed a free bilingual culturally tailored service that sends text messages via your phone to help you quit smoking. The message it has motivational tips. It helps you set a quit date. It gives you tips on how to handle a stressful situation where you might want to light up and convince you not to. And it also talks about if you need to talk to your physician or provider about the use of nicotine replacement, then don't hesitate to do that. This program is funded through our Cancer Prevention Research Institute of Texas, and we have been able to provide this service, free of charge here in Texas. And this is just some different phases of it. We've enrolled over 800 young adults here in South Texas to participate in the program. And the way we enrolled them is that we had social media ads letting them know that this program was available, had them signed up by just texting a number and just telling us very little about themselves, maybe their age, and kind of where, what area of the state they lived in, but we didn't ask for much. And right now, our preliminary results are showing that we had a 21% impact on getting individuals to quit smoking. The second phase of our program is to really now take it to Facebook, maybe place it on WhatsApp, and to also develop an anti-vaping protocol. And so this phase 3 is also another phase. So that's phase 2. Phase 3 is to really work with our providers. It's unfortunate that we still see patients coming in that are smoking either in primary care, and yet they may have cardiovascular disease, may have diabetes and other health issues, or may even have cancer, and they're still smoking. So our third component is to work with our providers to make sure that they assign their patients the opportunity to enroll for our program. So it's the young adult program. It's now incorporating a program that's encouraging them to quit vaping if they are vaping. And then the third program is to really bring that into the clinical settings and having another tool for our providers to recommend to their patients. And by quitting, this is all on a personal and private basis. These are messages that are just sent to the individual directly. And so then we might ask ourselves, okay, where are we going? And what are some of the lessons that we've learned so far? What we're seeing here is that, digital content curation can get needed, culturally relevant information and action to specific advocates for grassroots systems changes, because we know there's a lot of racism out there and we need to know and how to break some of those systemic problems that we have in our communities. So this is one way to inform and motivate people to want to create change. We also know that using Latino peer models with what we call psychological inoculation can promote, in our case, we used it for vaccine promotion to help overcome some of those myths and misconceptions that were out there. And by seeing and hearing other people like themselves, they were able to say, well, if that person did it, maybe I can do it too. And then with tweet chats, we were finding it to be a very powerful tool for public health practitioners to engage audiences on Twitter around specific health issues, advocacy issues, and potential policy solutions to encourage Latino health equity. So, we need all of you to really help us address racial and ethnic concerns. And so we hope that you'll join us. There's been a decade of racism-infused social and economic and political systems that have led us to inequitable communities of color that have been disproportionately burdened by stress, disease, and premature death. So in response, you as local leaders can create positive resolutions to declare racism as a public health crisis and to commit to specific policy changing actions as a first step toward meaningful change. So to encourage further action, we created another new system or policy change action pack, and you can download it by going to the Salud America action pack to create a meaningful resolution on racism as a public health crisis. You can connect with local advocates of color. You can draft a resolution in your community. You can start a conversation with your local leaders, and you can build support for a resolution to declare racism as a public health issue. To date, we've received over 700 downloads and more continue each and every day. And then we also know that, we need to spur action to increase knowledge about implicit bias. We all carry some type of implicit bias. We may not think so, but it's something you were exposed to in childhood or whatever. And we just need to be cognizant of it and to realize that we ourselves need to change. And implicit bias acts through many health systems, and we need health systems changed, one person at a time. So, we recognize that you can help in this effort. So please go and see if you can download our implicit bias action pack. And in there, you'll find, frequently asked questions. You'll find a guide for the EHT, which is a brief test to show you, exactly where do you fall on this, and think about and reflect on those results and say, personally, how can I change and become a better and more sensitive individual to issues that are out there in our community. And we also provide technical support to enable people to identify their biases and to take steps to overcome those biases by increasing your awareness of the benefits of diversity in medical care, in clinical trials, and in wherever we might be seeing some of those biases occur. And we also want to, use more, promote and disseminate credible health information. We want to use social media to help direct followers to credible sources of current information, how to troubleshoot, because there is so much misinformation out there. So how can we improve that? We want to raise public awareness about new and emerging and annual healthcare concerns. This is as simple as reminding followers about common sense health practices or ways to address underlying health inequities. We want to combat misinformation. We want a consistent and reliable voice of critical resources for people, in a time of crisis that they know that they can go to and find the information that they need. We want to be able to answer common questions that our community might have, and so these social tools kind of offer creative ways for us to get that information, not only to our healthcare professionals, but also to the community members that are asking those questions, and also to provide that opportunity for action, for citizen engagement. Social media communications can drive people to specific actions. And then most of all, patient support. In a recent study of liver cancer patients, providers, and families who joined our FACE group, 95% that they were joining the group because it had been positive for their health care. So this is another way of, creating that social support network that our individuals need. So, and it can also help you in patient recruitment, building social support networks to offer opportunities for study participants to stay much more engaged. So as I come to a close, we have a tremendous responsibility to provide credible, relevant, and equitable information for Latinos and all patients of color so that they can achieve, health equity. And it's just so important for us all to work together to make this change happen. I encourage you to go to our website, and if I can help in any way, please let me know, and I'll be glad to assist you. So again, thank you so much, Jeff, for the opportunity to be here with this wonderful group today. Thank you.
Thank you so much, Dr. Ramirez. Excellent presentation. So much to take in there. One of our presenters yesterday talked very broadly about the importance of cultural competency in eye health care. Can you talk a little bit about why it's important to ensure cultural competency among eye care providers when working with the Latino population?
Sure. One of the things overall is that less than 6% of our Latino population have doctoral degrees. So we're not going to see very many individuals that look like us as health professions. And so our community is looking for individuals like themselves and trying to go to someone who might understand their language, who, maybe they don't have to be fluent in Spanish, but that just some of that, the charisma, the cultural nuances that they recognize, that if they come with several family members, it's not like, oh my God, how are we going to get them into the clinic exam room, but more like embrace them, knowing that the family is there to support the patient. And so all of these things are so important in that cultural competency to feel that you really care about your patients. And so there's various ways that people can become more observant of that. There's training programs and so forth, but also we need to raise the level of our Latino population and encourage them to go into different health fields.
Yeah, absolutely. It's so important. We know, unfortunately, that the Latino population has a disproportionate impact of eye health. Often because of high rates of diabetes, but there are other factors as well. And so making sure that Latino populations have access to appropriate and culturally appropriate eye care is important. So you mentioned a little bit about the work with social media and smartphones and technology, but how do you reach out to those folks who still don't have access to modern technology? And there still are some of those folks out there.
Right. No, and the whole digital divide, that not everybody has a computer in their home, but more than likely you're going to find a cell phone of some kind. But we also still use traditional media, and particularly for the Latino community, they really like to use radio and television. So that's the one thing that they can put on in the background and really turn to that as a source. But also family and friends are critical, right? So again, we have to control the misinformation and empower the people that are going to be sharing the information, that they have the right information to share.
Yeah. And do you do much as it relates to targeted outreach? For example, targeting rural populations in different ways than urban populations, or different Latino subgroups based on their countries of origin?
Right. No, great question, Jeff. And we do, we find that in our rural communities, you'll have a higher utilization of Spanish. So, we tried as much as possible to make sure that when we're delivering that information, that we have somebody who's bilingual that can answer any questions that might come up, or to facilitate, focus groups or anything like that, that we're going to have that individual needs to be truly, bilingual. So those are some of the ways. And then again, we try to work with some of the local media in town that is respected by the community from the rural perspective, And here in a more urban setting, again, we try to do surveys to help give us a better indication. Many people say, well, I get my health information from the doctor, but we know they don't see the doctor luckily if once a year, but more than likely it's been several years since the last time they saw a healthcare provider. So we try to blend those in, and some of our heroes are providers themselves, because if patient can't see them directly, but they'll visually see them, they feel like that physician is talking to them. So we try to integrate all those little special aspects to make our message as relevant as possible.
I imagine there's kind of a generational aspect to it as well, where you may have within one family people who maybe only speak Spanish, those who are bilingual, and even some who only speak English. And so communicating across those barriers is important as well, I imagine.
Yeah, no, exactly. And so sometimes, we don't have all our information in Spanish because it's expensive to get everything translated. But what we do is we try to put in key words that maybe as growing up in your childhood, you were used to hearing, and so that they can gravitate to that information and say, oh, that information is directed towards me. And those are some of the things that we look for our role models too. Not all of them are, 100% Spanish speaking. Here in South Texas, what we see is there was a lot of racism in certain communities. And so in those communities, parents didn't want their children speaking Spanish. So, you'll have grown-ups who didn't get to learn to speak Spanish. I grew up in a border community where if I didn't know how to speak Spanish, I couldn't get a job, during high school and things like that. So, we were just bilingual, or to communicate with my grandmother. But, there are urban pockets where we see that's just not utilized. And the newer generations are moving away and not speaking as much Spanish as their older generations.